If you've started treatment or you're getting ready to, then you're probably wondering, what will the side effects be like? Will I even feel like myself? In today's video, I'm going to talk about some of the most common side effects that people experience while they're going through treatment and kind of what you can do to help get through it. I'll also touch bases on some of the side effects that I personally experienced and what I did to get through those. Because like in the beginning, everybody's going to talk about treatment plan, treatment plan, treatment plan, but you'll also need a coping plan. So trust me, you don't want to miss this. Hi everyone, welcome back to my channel. If you're new here, I'm Zacobia and I wear many hats, many titles. But what probably brought you to my channel and this video is the fact that I am a breast cancer survivor. And I talk about a lot of things that most people don't talk about as it relates to a breast cancer journey. So welcome to my channel and let's dive in. One of the most common side effects that a lot of people experience while they're going through a breast cancer journey and the treatment that it entails to get through that journey is fatigue. And we're not talking about like you're just tired. We're talking about like deep down to the bone exhaustion. Like you can't even get out of bed. Like you can barely keep your eyes open. Like you feel like you've been ran over like by a vehicle or something. Like that's how bad you feel. And to be honest, there's not a lot that you can do to help alleviate this. It's just with the chemotherapy and how it's affecting all your cells in your body, not just the bad cells, but the good cells too. It just really like burns you out. But some of the things that people will do is try to stay active when they do feel good. So on the days that you do feel a little burst of energy, try to get out and walk around and just do some of the things that you enjoy. For most people, it doesn't hit like right after treatment. It kind of hits like a few days later. And so those first initial days right after the treatment where you still feel really good and you have all that energy, like I said, get out and do the things that you enjoy doing. Like go, do all the things that make you feel good and that, like I said, you just enjoy doing with yourself. The other thing that will help with it is just trying to make sure that you are eating a good, nutritious diet. So whether it's smoothies or just, eating foods that are nutrient rich, you want to focus on getting that key nutrition into your body because that's what helps you to build back what basically you're losing as the chemotherapy is affecting everything. Another thing that helps with it is just making sure that you rest when you feel like you need to. It's okay to give your body permission to rest when it's telling you you need to rest because that is part of your healing as well. And that's what your body is telling you that it needs during that time. So, if you get to the point where you like feel like you honestly can't move another inch, then take that break, take the time to rest and don't feel guilty about it. Because just understand what you're going through is normal for the side effects that are associated with the chemotherapy that you're receiving. Another side effect that a lot of people experience, and this was one that I kind of like experienced a little bit, but it wasn't like the whole time that I was going through treatment, is nausea. A lot of people experience nausea or some type of nausea and vomiting associated with their treatment, especially if it's chemotherapy. Not everyone will. And again, even as I talk about myself personally, I didn't experience it the whole time. The first phase of my treatment, because if you've watched any of my previous videos, then you understand that I had a part 1 and a part 2 of my chemotherapy treatment. And so with phase 1, with part 1, I didn't have any nausea, no vomiting, no queasiness or anything like that. Whereas when I started phase 2 or, part 2 of the journey, there was a whole different round of chemotherapy medications that did make me feel nauseous or feel queasy. And so thankfully, like I said, I didn't have that the whole time, but there were a few weeks with going through those cycles that I did experience that. The queasiness is no joke, honestly. It's no joke. The way that you help yourself get through that is to get ahead of it as much as possible. Part of my treatment included pre-medications that were anti-nausea medications, pre-meds that included anti-nausea medications prior to my infusions. that definitely helped to where, again, even on the side, on part two of it, even, you know, with the nausea that I experienced with that part, it didn't hit me, until hours later. And I think it was, a lot to do with the pre-medications that I received. So with the pre-meds, don't refuse those. Definitely get those if that's part of your treatment plan. And then, making sure you get ahead of it when you get home. So if you get home and you notice you start to feel that queasiness, then go ahead and take the medications that they give you. Most people get a prescription for Zofran and Phenergan to help with that breakthrough nausea. And so if you feel that queasiness coming on, like, don't wait to take your medications, take it as soon as possible. Again, I didn't have to take it on phase one, but phase two, that's literally what I would do. And so another thing that I was not able to do as much because of the queasiness with phase two of my medication was fast. And so again, if you've checked out any previous videos, have a video on fasting during chemotherapy, which was a huge part of my treatment, my self-healing journey as I went through treatment. And so with phase two and, the side effect of nausea experience that I had with that, I wasn't able to fast as long as I did with phase one. And so it was just something that I realized I couldn't do because I would feel that queasiness come on. And so when I felt it come on, then I knew, okay, I have to go ahead and break my fast. And I have to go ahead and take this medication. And so something that helps is eating small, frequent meals when you feel that. Like, don't let your stomach get completely empty because the stomach acids actually don't help with that feeling. It makes things worse. And so having something on your stomach, something small, something light, helps to combat some of that queasiness. And another thing that I had was like like ginger chews. I shouldn't say supplements because it was really ginger chews. It was something that we found at Trader Joe's, which is a grocery store that's in our area, that I was able to take these ginger chews when I was pregnant, particularly with Matea. I had some form of nausea with 3 out of my 4 pregnancies. My first pregnancy, I didn't at all. And then each pregnancy after that, I experienced some type of nausea with them. And so with Matea, it was no different. I experienced it with her. And so we were able to find these like pure, authentic ginger chews, basically like a candy that was very strong, very spicy. It felt like chewing on real ginger, just with a little more sweetness to it. And they definitely help. They help with the queasiness during the chemotherapy, just as well as they help with the queasiness with pregnancy. And so that's something I would recommend. The other thing I would recommend is like ginger teas and things like that. And so there was a really cool brand that I found that was, felt like organic, or not felt like, that's what it said, organic ginger tea. And again, you can taste the spice that's in it that helps you realize that it's probably, as authentic as you can find. I know in the Black community, we are strong believers in ginger ale. If you're going to do any type of ginger ale drink, just make sure that it is like true, um, or ginger drink. It doesn't have to be ginger ale. If you're going to do any type of ginger drink, like a soda type fizzy bubbly drink, make sure that it is authentic and it has real ginger in it. So look at the back of whatever it is that you think that's going to be good for you. Make sure it doesn't have any artificial ingredients in it, because you want the real natural ginger to be able to combat that nausea and queasiness that you may experience. Something else that other people may use is like those C-bands, or those uh, basically like bands that they can put on that helps with, that queasiness or motion. That's the word I'm looking for, those motion bands. I personally don't have any experience with those, so I don't know how effective they are with side effects of chemotherapy, but it is something that I have heard that some people will use sometimes. So that's something to consider as well. But like I said, the biggest thing is just, making sure you stay ahead of it and try to keep your stomach from being completely empty. And just kind of, again, going back to what I said on the previous side effect, like giving your body time to just rest and heal. And so when I would start to feel the queasiness when I was going through phase 2 of treatment, I honestly just took that as I just got to lay down. Like I couldn't force myself and push myself in those moments, because I knew if I like kept doing too much that I actually was going to get sick and feel like I had to throw up, which I hate that feeling. I hate the queasiness also, but I don't think anything's worse than just being stuck, over a toilet, throwing up. And I knew I didn't want that. And so I just, listened to my body and just allowed, that time to just let me just rest and take it easy for a couple of days until it subsided. And then I was back out there doing the things that I enjoyed. And so overall, it would just be a couple of days that I felt that, and I never had to throw up during any of it. But there were times where I felt like I had to take my medication, and I took my medication like proudly. And it helped to, just kind of settle. The other thing, which I had not mentioned yet, that helps with getting rid of the nausea and vomiting, is basically clearing your system as quick as possible. So if you're not already drinking a lot of fluids, particularly a lot of water, then you need to be doing that during that time, because you want to be able to flush your system as quick as possible. Yes, you want the chemotherapy to circulate through your body, kill those cancer cells, and do what it needs to do, but you don't want it to stay and linger in your body, in your system, any longer than it needs to. So make sure you're staying on top of your fluids to be able to, excrete that through your urine and your bodily fluids, to get rid of it. Because the faster you get it out of your system, essentially, the faster you feel better and the more you feel like yourself. And so for me, it was a couple of days of me going through, my routine treatment plan, and then I would feel better and I'd be right back doing the things that I enjoy doing. The next side effect that most people experience that, that's hard for a lot of people, is hair loss. And honestly, like, it just depends on what your combination of chemotherapy medications are. Not everyone experiences hair loss, or not everyone has like complete total hair loss, but hair loss may be a part of the side effects that you experience with, particular treatment plans, particularly chemotherapy. And so with that, ways to help with it, there's something called cold capping. If you haven't researched that or been told about that, I advise that you look it up, because it is something that helps and it works to a certain degree. I didn't personally do cold capping. When I kind of researched and studied for myself, I didn't think that it would be, something that I would want to go through, honestly, just because you have to do it for the duration of your infusion, your therapy. And so I couldn't imagine being there with the cold cap on my head for 5 hours. Plus, in looking at the discomfort, or weighing and measuring the discomfort versus the results, there was a lot of information that was out there that was saying that you still lose, some of your hair, but people maintain a certain percentage of it. And, they were happy with maintaining what they maintained. I honestly didn't want to like have a percentage of my hair that I held on to. Like, I didn't want it to be thin, because I don't like how thin hair looks on me. And so I was okay with losing it completely and just starting over. That was something that I accepted and made terms with early on. And so I was okay with it. But for some women, they're not okay with it. Like, their hair is a big part of them and their identity and all of that. And so again, cold capping is an option. And it is, research that shows that it does help preserve, a good percentage of your hair, so that you don't lose it during that process. Now, the way it works is it, basically, dropping the temperature of that area of your scalp protects your follicles. And that's what, kind of minimizes the amount of hair loss and damage to the follicles as the chemotherapy goes through your system. Much like I've talked about before with protecting my hands and feet from neuropathy, which is also a side effect that I'll get to shortly. So I did this thing where I would do like ice packs on my hand and feet to protect them when I was getting one of my chemotherapy medications, the Taxol, which was known to cause like neuropathy and numbness and tingling and burning and all of that in your hands and feet. And so that was a big part of my like chemotherapy days, I would go in and make sure I had my ice packs, or that's what I started with at first. And then got, cool gloves that were sent and gifted to me that I could put on during that time. And so, basically it was, if you get the temperature of those extremities down as much as possible, then it, constricts the blood vessels and the blood supply to that area, and basically reduces the amount of chemotherapy that travels there, that ultimately reduces the damage to those nerves and everything. I'd say it worked because I don't have that as an issue. But again, just to give you an idea of how that cold capping works, it's the same concept. Like you're trying to preserve and protect those follicles as much as possible. So it is a thing. For those that are okay with the hair loss, I think the biggest thing I'll let you know is the fact that you will lose hair pretty much everywhere. So although I was okay with the idea of losing hair on my head, I wasn't too happy about like losing my eyebrows and my eyelashes. I didn't quite prepare for that. That hurt me or bothered me more than anything else. And so I'd say get ahead of that as much as possible. Learn how to, draw eyebrows back on that look as natural as possible, or get the tattoos, or, whatever the case may be. You cannot do the microblading while you're getting chemotherapy. I don't know any specialists, or I don't know what they're called, the people that do the microblading process. I don't know any that will do it while you're going through chemotherapy. So if that's something you want to consider, you have to do it before you actually start treatment. So again, preparing in advance as much as possible. That's the best advice that I can give you for that side effect. Same thing with the hair loss. Like if you make terms with just, not cold capping and going bald, but you want to do a wig, do your wig in advance. Like don't wait on the back end to do it. I did that and it was an epic fail in the wigs that I had as an option. But I also learned about myself that I didn't like wearing wigs, which I didn't think that I would anyway. But even in those desperate times, like I still didn't enjoy wearing it. So there are times when I would have it on when I didn't feel like I wanted to answer questions and all of that stuff. But ultimately, I didn't enjoy wearing wigs. So I never went out and invested thousands of dollars in them. But if you don't mind wearing them, they got some really good people like that make some really good wigs that honestly, like, the way they glue it and have invisible lines and all of that stuff, you can't really tell that a person is wearing it. So again, get ahead of it as much as possible, and get that stuff made in advance so that you can come to terms with that particular side effect. You also want to acknowledge whatever emotions or feelings that you're experiencing with that particular part of you. For most women, they've never been bald before, and so it can be a lot. And so give yourself permission, give yourself the space to grieve that and get through that. Oh, another thing that I did was learn how to tie the scarves. Really cute, because I didn't like the wigs, like I said. Plus, it was hot. It was summertime. So I learned how to tie my scarves and make the cute little turban, or the bantu knot. I'm sure it's not called bantu knot, but that's what we're going to call it. But yeah, I learned how to do those, and they look really cute. And when I learned how to redraw my eyebrows, my sister showed me how to do that. You honestly couldn't tell me nothing. So again, said all of that to say, get ahead of it. That's the best thing you can do. Get ahead of it as much as possible. Next up, I'll talk about the neuropathy, which is a common side effect that certain chemotherapy medications, that they cause because they affect the nerves in your hands and your feet. Uh, Ways to get around that. Again, the ice treatment. So ice packs on your hands, on your feet while you're getting the medication that causes that particular side effect. So for me, it was the Taxol. And so when I would get the Taxol, I would have my ice packs ready, and they would be on for the duration of me receiving that infusion. So I think it was like 45 minutes to an hour or something like that. And I would just keep it there in that cold space. Now, of course, you want to apply some type of protective barrier between your skin and whatever you're using, whether it's cold packs or the gloves or anything like that, because you don't want to get your skin burnt, frostbitten, and all of that stuff. So yeah, make sure that you protect the skin so you don't, burn your skin with the cold bags and gloves and stuff. But that is by far the best recommendation that I could give you in terms of protecting yourself from that. I did that every single time I got the Taxol infusion, and I can sit here and tell you I've never experienced any like numbness or tingling or burning sensation in my hands and feet. Now, I did have really bad joint pain, but honestly, like I remember the doctors trying to like link it to neuropathy, but I'm like, it doesn't feel anything like people who have neuropathy describe. Like what I felt like I had worked on my feet for 14 hours. Like it's just dull achiness. And it was only in my feet, not in my hands too. So nevertheless, it was a type of side effect that I was having, but I think it was more so related to what was going on in my bones and my joints and things like that. So, but yeah, for the neuropathy, didn't have any side effects with that. And again, I think doing some type of cold therapy definitely helps with that. The next big side effect, and I'm only covering like the main ones. I'm sure that there are other side effects that people experience too, but I'm kind of covering the main ones. The next big side effect that people experience is like burns from the radiation. Those that have to receive radiation get burned pretty bad, like a sunburn, but to the 10th degree, because it's targeted. You're going, multiple days a week, and you're getting that radiation beam um, sent to that targeted area to kill those cells in that area. And so, in the process of it killing those cancer cells, it also burns the skin pretty bad. So, you want to be able to get creams and aloe and things like that. The main thing, though, is that you want to talk with your team, your radiation oncology team, to make sure whatever it is that you have found that helps with burns, or what you believe that that helps with burns, make sure that it's safe to use it during that time. I know aloe is very natural, so that's why I say natural. That's why I say aloe, because it's a natural plant that helps to heal burns and skin irritations. There's calendula cream as well. But just double check with your, like I said, radiation oncology team to make sure that it's okay to use that stuff, because you don't want to use anything that's going to make it worse. You will probably get like a prescription for something that they, order that's specific to treating those radiation burns and skin irritations as well. And, by all means, definitely use what they give you as well. But just know, like, if that stuff isn't working, calendula cream and aloe vera and all of that stuff helps with burns as well. And so I'm sure it probably will be okay, but just ask first, because I personally didn't have to do radiation. So what I'm telling you is from stuff that I've heard from other people and their experiences. And so hair that it's really uncomfortable, very irritating. So you even want to make sure that you're wearing loose fitting clothes. And, if you still have your breasts during that time when you're getting radiation, you want to make sure that your bra is loose fitting and nothing that's too tight that's going to cause more irritation to that skin. I hear that it peels. Like I said, it's uncomfortable. But obviously people get through it, because this is something that people do, every day. And as much that's involved with treating breast cancer and all of that, I hear more people complain about chemotherapy side effects than I do radiation side effects. So again, it's not anything that you can't get through. So just having the right formula of things to apply to it is what's going to help the most. The other side effect that I experienced, that was related to what we believe was the immunotherapy that I was on, was just really bad, like skin irritation in certain areas on my body. I had really thick, flaky patches in my scalp that looked like psoriasis, that when I would basically try to comb it out, it would literally pull my hair out with it. So I had a lot of like bald spots and thinning from like trying to deal with that on my own at first, until I realized that I probably should see my dermatologist and get their help, which I'm glad I did. My dermatologist was able to prescribe an ointment that I could put that helped to treat those patches that was on my scalp. And the other thing was just real bad skin irritation in certain like folds, fold areas of my skin. And again, they were able to get me a ointment, a cream, not an ointment, actually a cream, a steroid cream to help with that irritation. So a little inconvenient to have to deal with the skin irritations, but ultimately, outside of the skin irritations, I didn't have any other side effects with immunotherapy. And so I was able to go through and complete that whole treatment plan for immunotherapy. But so my recommendation would be if anybody notices any type of like skin rashes like that, or any type of, almost like autoimmune response, going on with your skin and scalp and all of that, you probably want to have your dermatologist on your team. If you don't have a dermatologist, you probably want to get a referral from one during that time so that they can help treat that while you get through the immunotherapy. We believe it was that because ultimately once it all stopped, then it went away. It's just that we can't 100% say it because I was doing immunotherapy and a chemotherapy pill at the same time. And so, we don't know which one did it or if it was a combination of both of them. But my dermatologist, just based off of what they were seeing, it appeared to be more of an autoimmune type response. And so if you're doing immunotherapy, they were kind of linking it to that. And so again, might want to get a dermatologist on your team. The other side effects that most people don't talk about, and that most people don't see, meaning like those that are in your circle, that are your support system during that time, is the emotional and mental side of things. So anxiety, fear, brain fog, um, just some people fall into depression, things like that. Those are true, valid side effects as well. They're not your typical side effects that you see when you're going through treatment, but based off of what you're going through and how traumatic it can be, those are things that I feel like should be linked in the side effect category as well, because prior to the diagnosis or prior to, you going through treatment, you probably didn't experience those things. And so if you're experiencing it because of what you're going through, I think I could link it in the side effect category. And so, making sure that you're talking to your team as much as possible about how you're feeling emotionally and mentally as well, is extremely important. Making sure that you are sharing with your people that are closest to you, your village. Most people are so concerned about like how you're doing physically that they skip over the mental part, and it's not intentional. It's just not something that's at the forefront of most people's mind during that process. So, don't be afraid to throw it out there if you're not feeling like yourself. If you feel like you need a little bit more from the emotional standpoint of support, because, if they don't know what you're going through, then they don't know how to support you through it. But if you tell people, hey, I'm feeling a little down, I'm sure they may not have all the answers, but they're going to want to be there to support you. And you can help them through that because, you're feeling down and you don't know what to do, then, you might just need to get out and have some time with people you love and, spend time doing some things that you enjoy doing. So it's important to talk about those things as well. So don't be afraid to ask for help. Don't be so independent that you can't allow people to help you. All of that kind of helps to take some of that weight and burden off of you when you're going through that. With the brain fog and things like that, don't be afraid to write things down. Put things on your calendar. I lived by a calendar during that time because it's so hard to keep up with everything. And so, yeah, don't be afraid to write things down. If you're, going through something and you don't want to talk about it yet with your family, then maybe you want to get into journaling, and writing down what you're feeling and just still getting it out, but you're getting it out in a trusted, safe place, where you feel like you can speak freely and not be judged. I don't think your circle and your village will judge you either. But again, if you don't feel like you can share that stuff openly, doing something like that will help you, get that out as well. What else? Meal trains, things like that lifts a weight. It will lift a weight off of you. Meditation, your spiritual well-being, and if you're a believer, making sure that you're staying in the word, all of that stuff will help with the effects of the emotional and mental side of going through a breast cancer journey. So highly recommend that, if your foundation isn't strong, that you work towards establishing a stronger foundation in your faith, in your village, in that whole triad of support system, and everything that encompasses, you as an individual. Just, make sure that you focus on keeping that strong as well. All right, guys. So side effects, they can be very different for everyone. Like I said, these are just a couple of them. It's not every single side effect that, someone may experience. These are just kind of the more common ones that are, noticeable, and even, the common ones that I said most people can't see. And so, yeah, everybody doesn't have the same side effect, but as a person that's on the other side, I think I can speak for everyone that has made it through when we say, like, you're stronger than you think you are, and you can and you will get through, the journey. And so, again, having the tools in place, having basically someone like me that can come on here and share this openly and raw with you. I'm hoping and praying that this can help someone that's going through their journey, and just help them to be able to better handle it than those of us that kind of just figure it out and kind of just stumble along the way to make sure that we're good. But these are, like I said, things that I personally did, or if it was a side effect that I didn't personally have experience with, then I have someone that I know that did, and these are things that help them. And so I try to share things that I know for a fact are going to be beneficial to someone. And so I pray that it helps someone, like I said, get through their journey. If you found this video helpful, like, comment, share, hit the subscribe button. This will complete my mini series on from diagnosis to decision. If you have not seen all of the videos, then please check out the playlist, and go back and watch the previous videos that I've included in this mini series of from diagnosis to decision. And this kind of wraps up everything. And so in the meantime, continue to like, comment, share, subscribe. Thank you so much for your support, all of y'all that support me. I really, really appreciate it. But like I said, it's mainly to help someone in need. So please share with someone that's going through this journey. Please comment below if this has helped you in any way. And in the meantime, just, be ready to check out my next video when it rolls out. I don't quite know what I'm going to talk about next. I got some ideas, but I'm going to continue to do it in these mini series because I actually kind of like this. And let me know in the comments if you like the series too, because I like it. I feel like I'm, kind of, I guess, staying within a topic a little bit better when I do it in these mini series. So let me know in the comments below if you kind of like this. But yeah, be sure to check it out. And until next time, bye y'all. Peace.